All right, so we're going to get started. This is round 8 of the Derm Bros.
Yeah, we're very excited. I know today's topic is one that Dr. Greenberg has been anxiously awaiting to speak on. It's one of his favorite things to do in the practice. So he's put together the bulk of the work on the slides today. I'm really excited to see the cool stuff he's cooked up. We're going to have a lot of fun.
Yeah, I'm super excited as well. We weren't able to do cosmetics for a while. It was very painful. And now it's, open season on cosmetics. We're going to talk about the good, the bad, the ugly.
We don't say the U word in our practice.
The less attractive, the errors. I've got some really great, I just got permission. I had a patient, and you'll see it at the end. I'll put a little teaser out there, who had a horrendous complication.
Oh, wow.
And she agreed to let me show her slides. So that'll be at the end because
Wow.
Even though these are great and wonderful procedures, they're not without their risks.
Okay, perfect. Well, with that, let's get started.
Yeah, let's get started. This is a little fun video to sort of highlight everything we do, at least for this talk. Botox, fillers, Kybella, Instalift. These are cosmetic treatments that are non-invasive and pretty straightforward. So we have the Salt Bay throwing down some a little Botox, little filler, just a teaser. Some of the fun stuff that they're going to see today. Little lip enhancement.
That's nice.
More lip enhancement. Nasolabial folds. Marionette lines. We got the before and the after. Little Botox. Can't get the crow's feet down there. Drop a smile.
Did you put this music together yourself?
I actually made this music.
Is this your composition?
This is my composition.
It's a little funky. I like it.
Yeah, it's garage band funk.
Nice, man.
Thank you. All right, well, with that, let's
play it
again. So we're going to talk about the aging face and what happens as we get older.
Yeah, when I see a new cosmetic consult and people come in, they have lots of questions, and sometimes they're not sure which procedure they need. They think Botox fills volume loss, they think filler helps with wrinkles, and while that may or may not be true to certain degrees, I like to think of the aging face really in 4 domains. There's texture and tone, and we address that with lasers and peels, and we talked a little bit about lasers a few rounds back, and lasers all the time.
All lasers all the time.
Dr. Greenberg's other favorite.
Lasers, I think, are my first love, I'd have to say.
Texture and tone is an important thing when you're addressing rejuvenation of the face. Today we're not going to talk as much about that. Contour we are going to talk about. So as we age, the face changes contour, and that's because you start to resorb bone, you start to lose fat in the face, and contour is the beautiful shape of a car, a face, whatever it is that you like, a pretty vase. And you can add filler to recontour an aging face. Mm-hmm. Wrinkles, that's really done well with Botox. Botox helps paralyze muscles. If you can't squeeze your muscles together, you can't make wrinkles. Doesn't do much for wrinkles that are already there. And that goes back to all lasers all the time.
Yeah, and I think, with the Botox, usually from the cheeks up is where we do it, although we're going to show some jaw slimming procedures.
Yeah, there's some really exciting procedures you can do in the lower half of the face with Botox, but the bread and butter really is the upper half. And then lastly, gravity. So gravity is an inevitability for all of us, and that's really the realm of tightening devices and then lifting. We're not going to talk about tightening today, but we will talk about some lifting procedures at the end.
Yeah, and this always cracks me up. So we need to identify what the issues are. We need to build a plan, and then we get started.
Exactly.
So I like this video. I had put my faith in Dr. Cotter. I asked him what I needed, and he told me that I don't have any lips. So earlier in the year, he gave me some, what was it, Volbella?
Yeah, just half a syringe.
Half a syringe?
You need a couple more.
Little Kybella, thank you. Thanks for noticing. This is a video of us talking about what I need.
We're getting ready for the second part of the day of age. In this room, what we're going to do first are a series of injectable treatments. We're going to do a little bit of lip filler. We've got half a cc of Volbella, which is just subtle, enough to pump him up a little bit, but really no one will know you had anything done. Okay?
No, except for everyone in the video.
Right, everybody else in the world and you today.
A little bit of Kybella underneath the chin. But before we get started, I'm going to clean off your face, and then I'll put in some nerve blocks. Okay. And then we'll get started on the injectables, and then we'll transition over to the laser. Okay. Perfect.
Yeah, and one of the things is if you're going to get Botox, you have to wait 2 weeks before you can do any other procedure.
Yeah, there's some planning that goes into combining cosmetic procedures. We love combining procedures same day, but we like to do it in a safe way.
Yep, that makes sense.
All right.
We've had enough of that. Knowing the anatomy is super important. This is a Netter atlas, and while we were in medical school, we would have the Netter, have it out, and this is how we studied for our anatomy exams.
Yeah, and actually the best way to learn anatomy was as a dermatology resident when you're thinking about where you're placing your neurotoxin, what muscle do you want to paralyze to get a clinical effect, and that's really what goes into targeting the treatment. So depending on a patient's musculature, and everyone is a little different, you put your toxin in slightly different places at slightly different doses.
Yeah, and in the state of Nevada, we have to sell it by the bottle, so you get creative with how many units you're going to use and where you're going to use it. This is one of my favorite videos. This is Michaela, one of our assistants, who's getting Botox, and we'll watch her. So again, the Salt Bae came back in and was sprinkling Botox. And here I am. It's a series of pokes. We constitute our Botox a little different the way we do it, but you find the muscle that you want it to act in and you inject. And here I was doing frontalis, which is right up top. And here I'm also injecting frontalis. And in that photo there, I'm injecting in the glabellar complex, the corrugators. So
yeah, I think that sounds great. Botox. Can anyone get it?
Most people are candidates for Botox, bud.
But there's a caveat. So there's a few contraindications and relative contraindications, meaning reasons why a certain patient can't get Botox. And so a lot of times we're treating return patients, but for new patients, it's important to run through kind of a safety check first. And so Dr. Greenberg put some nice slides together to think about every time.
Yeah, we don't inject patients who are pregnant. We don't inject patients who have a nerve disorder, although some people, if they have one side that's paralyzed, you can paralyze the other side so it doesn't look so awkward. And then certain antibiotics, you want to be careful while they're on those. It's important to know that there are different botulinum toxins. The one we use the most of in the clinic is Botox, and it is FDA approved for the glabella, the frontalis, now crow's feet. Yeah, believe so. And hyperhidrosis, so for sweating and also for headaches. So there are multiple indications. We are using it off-label for jaw slimming in patients who have hypertrophic masseters. And this is frontalis. She's aiming the beam here, checking temperature before the mask mandate, of course, because that's where it is. And here you see frontalis. It's a muscle that lifts the brow, and when it lifts, you can see the wrinkles.
It's a general question that gets asked frequently. Does insurance cover any of these procedures? Oh,
that'd be so great.
Yeah, it would
be really wonderful if insurance would pay for things that made people feel good and look better. But unfortunately, Botox fillers, they're not covered by insurance for cosmetic purposes. Some patients will get injection with a botulinum toxin for nerve disorders or neuromuscular disorders where they have tonic contractions of muscles that cause distortion of the neck, lots of pain.
And torticollis.
And that sometimes is approved. That's usually done by a neurologist. But Botox cosmetic, which we're doing in our practice, is
not covered.
All not covered.
Sorry. Frontalis. You can see here there are lines at rest, lines, and then no lines.
Yeah, I think this is a really good point because what neurotoxin does is it prevents dynamic lines. Dynamic lines are the lines that occur during muscle activation, and it makes sense because you're paralyzing the muscle temporarily. Chronic activation of the muscles leads to these static lines or etched in lines. But if you notice her before and after, the etched in lines are still there. They do appear softened because there's always tonic baseline muscle contraction, but you're not doing a lot for the etched in lines, which is why it's good to start your Botox before you have deep lines. When you have just subtle, faint etched in lines, you can really prevent transition to deeper, more set in lines.
Yeah, and it's good not to worry. So if you can avoid worry, then you can avoid some of these lines. The other thing with these lines here is now would be a perfect time after this. Venus Viva, carbon dioxide laser, microneedling, all the stuff we've talked about. Some of it we've talked about before. And we'll move on to it later.
And I love to actually combine pre-op Botox for patients that have skin cancers on the forehead. Because what causes a scar, one of the factors that goes into poor wound healing is tension on a scar.
True.
So if you can't contract your forehead while the wound is healing, people have better outcomes. And that's been studied, and it's well validated.
So the orbicularis oris, this is a sphincter. We were talking about sphincters.
Yeah, I think Dr. Greenberg, you were interested in getting some sphincter tox?
Yeah, so my orbicularis is that sphincter that I would like to have injected at some point in the future. So thanks for pointing that out. We're going to take some pictures. If you inject low here, you can drop a smile because this is zygomaticus major. So you need to be careful where you're injecting. And here I've done Botox. This is before, no Botox. Before, she's squinting, she's trying to close her eyes, but you just can't get these without a laser or something else because you will drop that smile.
Yeah, you have to be careful.
Yeah. So, and then the corrugators, she's bringing this glabellar complex together, the so-called 11s, and here, she's bringing it together, can't do it, but you can tell that something's happening, and the nasalis muscles, little bunny lines.
So this is a nice treatment that I like to add in, especially on my chronic repeat neurotoxin patients. And the reason why is when you paralyze the glabellar complex, over time people start to recruit their nasalis muscle. And when they're trying to scowl, they end up contracting their so-called bunny lines. So usually I'll pepper in a couple of units on either side of the nose to paralyze the nasalis to prevent that overcompensation. And
so,
we'll have a nice video of that.
Yeah, that's the next one, actually.
Oh, perfect.
I have the benefit of seeing all the slides before Dr. Cotter, but he's so sharp, he can just pre-do them.
So this is one of our medical assistants, Jasmine. She's just a superstar, and is morphed into our clinical trials coordinator. And there's some videos of kind of what I call all together now, putting together the 3 bread and butter treatments. So I think the first one is her frontalis. This is pre-treatment and then 2 weeks after treatment. And you can see she can still animate, she can elevate her eyebrows slightly, but she's not getting those wrinkles. In the middle, we have the glabellar complex, and I also treated her bunny lines because really that's where most of her wrinkles were coming from, and so I treated both areas, and it made a really nice difference.
Yeah, I think it's interesting. We all have different anatomy, and all of the muscles are different. Usually men have stronger facial muscles than women, but not necessarily always the case. And here you can see her bunny lines were really
strong. And then for her crow's feet, she didn't have much to begin with, but definitely a nice treatment.
Yeah, no, that looks fabulous. This is just showing some jaw slimming with Masseters. And here we injected along the base and two injections and then a third just to soften the muscle. The problem with this injection is it may make it difficult to bite down fully, and you can get food caught in the jaw.
Well, I think it's a really nice treatment, and I'm sure she was very happy with the jawline slimming.
Yeah, she was thrilled.
I think it's important to point out that masseter slimming, the way that it works is you're actually atrophying the muscle. So just like any other muscle, if you're not pumping that muscle, it's going to weaken and shrink over time. So generally, I mean, a treatment like this, would this take 2-3 treatments, maybe 6 to 9 months, or how long is the time lapse?
No, this was a month later. So we only did 1 treatment for her, but it was the first time.
That's really good.
So a lot of times, the first time that you do a treatment with Botox, there's not a problem, and the effects are quick.
Yeah.
Usually, over time, it may take 2 weeks, may take longer, and I've even seen some people who it stops working.
Yeah, and it's a nice treatment for people that grind their teeth as well.
True.
Dr. Charisse McCall on Instagram is asking, how many units do you like to use in each masseter on average?
So it sounds like Dr. Greenberg got a great result with 1 treatment. If I'm treating a new patient for masseters, I'll usually split 50 units between each side. So I'll do 25 and 25. And then at the follow-up visit, I'll do 50 and 50 if a patient's tolerating it well.
50 and 50.
Yeah, so,
Wow.
masseter is a big muscle,
Yeah,
and it
true.
needs a lot of units. But you like to go slow first, because what happens is if you over-atrophy the muscle, there'll be too much tissue laxity. So you actually want to shrink it a little more slowly. If you're really being conservative, you might even do 12.5 and 12.5 the first visit, and I guess you could go to 25, but...
No, I do 25 to start as well.
Yeah.
So, yeah, that's excellent. Platysmal band's not FDA approved, but this is a nice area. The side effect possibility, and every treatment has a side effect. There's no free rides, as we're going to show some pictures that may make you think twice about getting cosmetics, or doing more in-depth research about who's doing your cosmetic injection treatments, because the problem is, it's really easy to do a procedure and it's really difficult to deal with the
Yeah,
complications.
I think that's perfectly said. I really do like injecting the neck,
Me too.
particularly platysmal bands and then along the jawline. Now, a lot of people don't realize that the platysma, even though it's a neck muscle, really helps guys shave, but it actually inserts along the jawline. So even though it originates down here by the clavicle, it inserts along the jawline. And so what happens over time is you flex that muscle, it contributes to pulling down on the jawline. So treating the platysma over time will actually help redefine the jawline, and then you can pepper in units along the jawline to really kind of give a neck lift per se. And it's a nice treatment. It's something that people don't come in asking for, but when you talk about it, people are always happy to have it.
Yeah, it gets noticed. You can have difficulty turning your head and difficulty swallowing with that treatment. So
Yeah.
it's a warning.
I don't usually do more than 40 units in the neck in one treatment.
Wow, that's a lot. I usually do, I don't know, four. Yeah, I probably do. I'd probably do about 24 in there. So yeah. This is one of my favorite places on earth. This is from Vail, Colorado, and I'm due to get my ski pass. If they have skiing, they cut short the season last year. But in skiing, you have the green circle, which is the easiest. You have the blue square, which is medium difficulty. You have the black diamond, which is experts only. And then the most difficult is double black diamond.
So what are we moving to next up?
The reason I put this picture in is because sometimes there are no good answers. This is...
I don't know. You want me to give you a syringe after you inject yourself? No. Right.
So this was just a funny little video clip here where sometimes people come in and they want to tell us how to inject them and where to put the stuff based on an Instagram photo that they've seen or some other.
I actually had a patient come in recently with an Instagram filter, and she said, "Hey, can I show you how I want my lips to look? There's this cool Instagram filter." I said, "Yeah, sure. Show me what you have in mind." And it actually, to my surprise, it really guided the conversation, and we were able to kind of give her more of the look she was looking for instead of the look that I thought she would want.
Yeah, that's good. And I think what I like to tell people, at least, is I can make you a better version of yourself, but I can't turn you into somebody else.
It's good advice.
That's mine. Just a before and after lips. And here I'm injecting, and then here Dr. Cotter is doing some injections on one of our assistants, Michaela.
Oh, this is an old video. Wow, look how short that hair is.
Yeah, it's really short. I think that's your brother.
Yeah, I don't know who that guy is, but he doesn't work here anymore.
He was like, no. All right.
That's great.
I don't know. You want me to give you a syringe after you inject yourself? No.
Yeah, sometimes people do want to inject themselves, and they'll just come in. But there are risks, and we'll see them later, in injecting the lip because it's a super vascularized area. This is not something to be taken lightly.
Yeah.
And you should be taking or considering taking some medication beforehand to reduce bruising and risk of herpes virus reactivation. So what do you like for filling and volumizing, Dr. Cotter?
Well, apparently there are lots of great options depending on the location. And I think that's true. I have my favorites depending on the area that we're going into. But it really depends on the patient. It depends on what the deficit is, how much volume is lost, what they're really looking for. Some products are a little thicker, a little denser, better for defining bone structure. Some are softer for a soft lip. Some people want to line their lip. It just depends. I always use different products in the tear troughs than I would use in the cheeks, for example, but it really requires a consult.
Yeah, and that makes sense. And everybody's different in terms of what they need. We use a lot in the clinic, at least my favorite, are these hyaluronic acid fillers because you can dissolve them if you don't like them.
Absolutely.
There are other fillers that you can't dissolve, and sometimes that's a problem.
Yeah, no, there's a lot of great options. Even in the non-dissolvable realm, there's one that's actually calcium hydroxyapatite, which you can get some really nice results with, but you can get into a little trouble if a patient's not happy. I have a patient who had a complication from another place that I've been seeing who has a lot of facial swelling related to calcium hydroxyapatite that was placed throughout the face, and you can't do much to remove it.
Yeah, it's bone
permanent.
cement.
It's bone, and so if you have a bad outcome, it's a challenge. So I too like to stick to the hyaluronic acid-based fillers, probably 99% of the time.
These are just the bread and butter, the easiest treatment, I think, for fillers. Going in these nasolabial folds gives a dramatic improvement, and you can see how it just softens the lines and makes somebody look more youthful. This is really good for somebody in their early 30s depending. I mean,
Yeah.
everybody's facial structure is different, so that may not be the procedure for you. And then this one, this was Dr. Cotter's.
Yeah, this is
treatment?
nasolabial folds, and just something subtle. One syringe split between the two sides. Still looks like the same person, just a little more refreshed. Now, going a little bit outside of the box, I like to fill the temples, especially if a patient has a deficit. We see a lot of people that come in, they're fit, they're young, they're healthy, and they just can't maintain their temporal fat pads. It's really common, and it's something that most people don't notice, and so unfortunately you have to point it out, which usually goes okay, because it's a really great procedure. So when you do point it out and you fill it, what it does is it helps re-ovalize the face. And this is a lovely young patient of mine who, again, super fit and has very scalloped temples, and splitting 2 syringes of voluma between the temples, it really helps, I think, highlight the eyes, restructure this contour. This is immediately before and after.
Yeah, I mean, that's fantastic, and I'm sending you all of my temple patients.
Please do. I usually recommend doing at least 2 syringes at the first visit and then coming back in 2 weeks to split a third between the two. Because you don't want to overfill it, but most people usually do need more filler than they anticipate because the temples really are a deep area. It's also a very high-risk area and requires a lot of careful preparation and delicate technique.
Yeah, no question. Are there any questions out there? Okay. We'll hand it to you the next slide.
Keeping on, no, that's nice. Keeping on that hand, another place I like to put filler where people don't always consider right away is in the hands. You know, a lot of people are focused on the face, but the hands really do show our age. And this is an instantaneous response. I mean, you put filler in the back of someone's hands and it helps minimize the appearance of the veins, the tendons. It's just a really nice treatment and it's super reproducible. It doesn't really matter how old or how thin the skin is in the hands. This is an older patient than before with much more severe volume loss. And you just have to use a little more filler. She could probably even use more than this.
Sure.
And then on the other side is another patient immediately before and after who was really bothered by atrophy on this hand, which was from a cervical spine injury that caused decreased nerve conduction and muscle atrophy. So we went ahead and filled both hands, and then she came back a little while later, and I didn't have the photos, to really address this atrophy from the nerve injury, so we plumped that up at a follow-up treatment.
I mean, those hands look better, so much better. And then, sometimes people do this and they'll want a carbon dioxide laser after, or they'll want like a pigment correction.
Oh yeah,
laser.
no, I mean, I love combining filler with lasers in the hands because you can address all of the little freckles, you can resurface the skin, and you can plump it. It's a nice treatment.
Yeah, I think you and I would both agree that we're showing the filler talk, but we really, there's a complete treatment here. People just don't come in for one thing, and many times there are multifactorial issues going on at the same time.
Absolutely.
I have Rick Zeller on Facebook stating, my fiance had her hands done by Dr. Cotter and had an amazing instant result.
Oh, look at
Thank you, Rick. That's great.
That is so
I think they
nice.
look great too.
These are just another set of hands that I did. I don't end up doing a lot of hands just because of the cost, at least.
It's expensive. I mean, like some of these hands, this was, going back the other way, this was 2 syringes of filler and this was 3. I mean, it's not an inexpensive treatment. And
Sure.
I think if people are focusing on their face primarily, it's a big cost commitment to do the hands, but it really is a nice procedure to have done.
Yeah, and I think each of us has different insecurities and things that bother us. So if you're bothered by your hands, well, then get your hands treated.
Absolutely.
We have to listen to what people are wanting done. And I thought this was fabulous. This is Tammy, who's our back office manager, does a great job. And
Yeah, she'd actually come to me primarily concerned with kind of looking tired and bags under her eyes. And I said, well, hey, let's do some filler in your cheeks first because you look a little flat in the mid-face. And so we plumped it up with Voluma. And this is a really great result right away.
yeah, she looks fabulous.
And this is no filler in the teardrops. This is just in the cheeks.
I mean, she had nice volume before, and this it sort of accentuates those higher cheekbones.
Yeah, and I find too when you fill the upper face, whether you're starting with the temples and it opens the eyes, or you go to the cheeks, it actually gives you lift through the nasolabial folds. So sometimes patients will come in and say, I'm bothered by this, but they have flat cheeks. And so you end up filling the cheeks, you need less filler in the nasolabial folds or the marionette line. So I always like to do a top to bottom approach.
Yeah, it's a great result. This one I thought was really nice too.
Oh, thank you. This is another patient, immediate before and after, same day photos, who, same type of thing, was really concerned with a tired look underneath her eyes and came in asking about under eye filler. I said, I really think we need to do your cheeks because if you overfill the tear troughs and don't address the cheeks, what happens is you blend the eye and the cheek. You get a chai, which is kind of like the cankle of the face, you know?
So
cheek eye.
bad.
So we don't want chais. So what we did first is went in and split 2 syringes of Voluma to the midface and redefined her zygomatic arch and then the projection of the cheek. And I think the profile really shows it nicely. I mean, really rounds out the apple of the face. And I think she looks really, really
Yeah, she
beautiful
looks
after
fabulous.
this treatment.
And this is the same thing that you and I were talking about before. So now that you've corrected that, then she's going to say, well, you know, let's correct some of these brown marks that I have. You know, There's always something.
And you can see, I mean, this is the type of correction I'm talking about. If you look at the nasolabial folds, they're much softer. And this is a patient that had come to me for a second opinion after having an Instalift somewhere else, and she wasn't really happy with the amount of lift she got. And that goes to a point. I like to address the volume deficits before we lift. So,
Yeah.
you know, filler, then lift.
I mean, and the Instalift's a great procedure, but I was talking with somebody about that earlier today even, and you know, it's an expensive procedure, and you have to be aware of what kind of results you're going to get, because it's going to be a mild result. You know, sometimes people just need a facelift.
Underscore D Nichelle on Instagram says, I want under eye filler, but I'm scared of the risk of becoming blind.
Okay, well, blindness is a risk with filler. I mean, it does occur. The highest risk areas are actually the glabella and the nose, then probably the temple, but most of the reported cases of stroke or blindness come out of cases where someone was trying to fill the 11s in the glabella or fill the nose, kind of doing a non-surgical rhinoplasty. And personally, I don't inject there. I advise against it. There are some people that are very, very good at it, but it's not something that I do. I do think that under eye filler is overall very safe considering all of the different areas. The most likely occurrence is you'll have a little swelling for a week, and then second to that, you might get a shiner. I mean, you know, funny personal story.
Or bluish tinge,
So
the Tyndall effect.
So the Tyndall effect, if you're using the wrong filler. So if you put the right filler in, there are some fillers that can be placed superficially, and you don't get the Tyndall effect, which is a bluish hue related to the deposition of the filler. I like to use Bellatero in the under eyes, and if you wanted to come in for a consult, I'd be happy to see you. I know Dr. Greenberg would too.
Yeah.
And we get you squared away. Probably look really nice.
Yeah, and you can, you know, sometimes you can mash it down. The thing with the hyaluronic acid fillers is you can always dissolve them too, but obviously, you know, the goal is, and it doesn't require that much in this area.
No,
either.
it's actually, you want to aim to undertreat. I mean, overfilled tear troughs, you see a lot
they can
of,
look
it looks
awful.
bad, and then people smile and they have a golf ball under their eyes.
I mean,
So
I love the carbon dioxide laser for around the eyes. That's my favorite.
it's a nice treatment. TCA peels are nice too in the right skin types. I think we have a question.
John Chloe on Instagram asks, do you use the cannula technique for tear troughs?
All right, so cannulas or cannulas are these long tubes. I don't use cannulas. It's not my thing.
So I use cannulas depending on the patient and the case. So I almost always use cannulas in the hands, and I 50-50 use cannula in the tear troughs. And it depends on the patient. Sometimes you get less bruising and less swelling with the cannula technique, but depending on the tear trough, sometimes a single poke with a needle, you can place it very delicately, and people do just fine. So it would depend on the case, but certainly I'm comfortable doing both.
Yeah, and I'd say it depends on the artist too, because some artists do well without cannula, and some do well with. It depends on what the person who's doing the procedure feels the most comfortable with.
Yeah, absolutely.
I've gone back and forth on cannulas. Now I'm out on them. I'm done, But they are good because what a cannula is it's a blunt tip. So you know the theory is that if you're injecting with a syringe, it has a sharp tip, and you can pierce an artery. And the cannula, you're
Yeah,
gonna
there
avoid
have been
that.
reported instances of people getting into a vessel with a cannula too,
Yeah.
though. So nothing is.
There's no free rides.
Yeah, no free rides.
This is just some pre-post-op suggestions depending on the person. Some people like to take arnica. It's from a plant that's grown in the Rockies. Bromelain is pineapple extract, and then acyclovir Valtrex is good for people who have cold sores. And you really need to be straightforward with the person who's doing your procedure, even if it's a distant history of those things happening. It's worth prophylaxing.
Yeah, it's simple enough just to take one. How often are you advising your patients to take these anti-bruising medications?
Never. But some people want to ask.
Yeah.
And when they do ask, there are options. So in the case of a person who wants it, we do have it available.
Absolutely.
They're just not necessarily proven to
There's
work.
also some arnica pads I'm aware of. I haven't used them here, but let's say you're getting filler in the cheeks, you can put these arnica pads on immediately post-procedure that are supposed to be helpful.
So if somebody just has filler, and you'll see the slide later, a lot of times we'll do light stim. I don't do the light stim after Botox, but that's an LED light.
Yeah, I love doing light stim, especially after lips.
Yeah, I agree. And a lot of ice. This is Pronox. Some people are just nervous. Dr. Cotter and I do our injections a little bit differently in terms of anesthesia and analgesia, but the Pronox is a good option for people who are a little bit squeamish. And
Yeah.
Yeah.
I have some patients that use Pronox for their Botox, and they love it.
Sure.
I have other patients like Dr. Greenberg that like to use Pronox for their lips and Kybella.
It worked very well, thank you. It's not just women who get injections, men get injections too.
Absolutely.
Like me, like my patient here.
We do a lot of Brotox,
Yep.
Botox for the guys, some Scrotox for guys that want a little
I
extra
haven't
down
done
below.
that yet.
I had a guy come in recently asking about filler for the penis even, so
I'll be sending them your way.
lots of off-label uses, but there's no shame here. It's all skin. If you got skin, you're in.
Yeah, I mean,
Take
there's
care
a
of
lot
it.
of places that you can do it, and we'll see some photos of scars. It's a nice place to inject filler when nothing else works. There's a couple different ways to do lips, and I thought it would be nice just to show these different lips and different techniques. Here, she doesn't have a very crisp border. This is a white border, and so I lined her lips, and you can see that the lips just sort of pop a
Did
little
you
bit
fill
more.
her lips too, or is that just lining the border?
No, that was just, I think I put just a tiny bit, whatever's left over. So usually it takes me one syringe to line an entire set of lips. Different people have different size lips. So if there was left over, I put a little bit down there.
That's a nice result.
Yeah. And this one, she just really wanted to focus on her upper lip being larger. Usually the lower lip would be larger for this particular patient, but she wanted the upper lip.
That's a nice
focused
result. And every patient is different. I know I tend to go more towards a natural lip. I'm the more conservative one, I think, when it comes to these types of things. But I think that looks really great. And it definitely has kind of more of a 50-50 split in terms of lip volume. But you can get away with that in some patients. And I think it looks fabulous.
So this is one of my favorite people in the world. This was my friend Kristen, and I did her lips and did 3 syringes of filler, about 2.5 in her lips. She wanted massive lips, and I'm going to take you through what it looked like while it was healing, because this is a lot of filler. And put some filler in her nasolabial folds. I mean, she's a beautiful lady, and she was happy, but she just wanted bigger lips.
Yeah,
And
you can tell she's happy because you can see the happiness in her eyes in the follow-up photo.
Yeah, no, she was thrilled with them. And when we took her through what happened, she was so swollen the day after. And I had done 2 syringes, and she asked for the third. And we actually went to dinner that night, and it was with my mom and my aunt. And she was at dinner. She couldn't eat because her lips were so sore. And I was cracking some jokes, and it hurt to laugh.
Well, that's what I always say, is the more you fill, the more you swell.
Yeah.
So for some patients, they're not sure how big they want to go. I say, do half a syringe or do 1 syringe. And in 2 weeks, when the swelling goes down, if you're relieved, then you do the right amount. If you're sad, then you need more.
Yeah, and that's sage advice, because I told her, she came back after lunch to get even more filler in there. So these were really big, and they just massively swelled. And then the swelling went down, because it always goes down after the filler. And to help with that, ice 15 on, 15 off every hour is the way I do it.
Absolutely.
But she was really happy in the end with her result.
Looks beautiful.
Yeah. This one here, so this is Marianne, and she had her lips done, and she wanted just her filtral columns, which are these areas here. She had very sort of flattened filtral columns, and we defined that border. And she was the one in the picture who was holding the.
Oh, who wanted to inject her own lips.
Yeah, she wanted to inject her own. She was holding the little, I guess, what was that, little swab, so I wouldn't inject in the pillows, or just in the pillows, and leave the middle bit, leave the pout gone. But she was pleased with this. This is 2 syringes. I lined her lips, so you can see the more crisp border here. From the after than the before, and a little bit more voluminous.
It looks nice. So this is 2 syringes, 2 different syringes?
Yeah, 2 full syringes, and they're in the filtral columns. This is a little bit whited out on the image here.
It looks nice. Yeah. This is one of my patients, and again, this is just more of a subtle natural lip. This is just half a syringe of filler, and you can see it plumps the lips nicely and increases the projection. So when you're looking at the profile, that upper lip is sticking out in proportion to the lower lip. And I think this is a really nice result for half a
Yeah, I
syringe
agree.
of
She has
filler.
more red show here. Yeah, it looks nice.
Yeah, a little bit can go a long way.
Yeah.
And this is another case of a little bit goes a long way. This is a patient who had always wanted to get her lips done, but was really nervous, was kind of afraid of looking overdone, didn't really want anyone to know, but wanted something a little more. So this is, again, half a syringe of filler. And really, I mean, we really recreated this upper lip. And same type of thing, a little more red show in the profile, and she was super happy with it.
Yeah, like we've been saying the whole time, everybody's different with what they want. And, you know, she may have felt that this was massive, even though you and I look at it and say super subtle.
Yeah, very subtle.
Super subtle.
But like we were saying, it just depends on the patient. So this is about 2/3 of a syringe. This is one syringe.
Yeah, I love these. These
and
are
this is
great.
2 syringes.
Yeah, these are, yeah, they both, all of them look really good, nice and full. You know, and the more you put in, you can see the lip lines just sort of getting erased.
Yeah, exactly. So again, like 2/3 of a syringe, 1 syringe, and 2 syringes. So we can go as big as folks want, but generally, you know, it's nice to make sure that we're respecting their facial anatomy.
So this guy here, he doesn't have an upper lip, and
Well, so little. Is this your after?
yeah. So this is my after, and you can see I'm smiling, and there's no lip there. I mean, it just disappears.
We need to get some more in there.
So yeah. So maybe we'll do it again. I was never bothered by my, you know, thin villainous
So you started
lips.
getting bullied by that other doctor at the practice?
Another bully in the practice. Well, that's why I've been taking those Kim Couture classes. You know, I'm getting ready.
Yeah, she told me she might, you know, puff up your lip for you.
Oh yeah, that'd be nice. What, like a straight kick or a, you know, uppercut. Anyway, so these were the ones that Dr. Cotter did. I think, did you do both the upper and the lower?
Yeah, you know, Dr. Greenberg was very nervous. It was his first time having his lips injected.
Yeah.
Maybe his first and only, we'll see. So we
You can do it again.
We split half a syringe between the upper and lower lip, which is really not very much.
Is that like
at all.
0.3 then? Is it a 0.6?
0.5.
Okay.
0.5 cc's. Yeah.
Yeah, I didn't know with full Bella if it was smaller.
And this is a patient who wanted to go big, and we did 3 syringes between the nasolabial folds and the lips. And this was a really nice result. It plumped up a lot, but one thing to point out is if you have a natural irregularity in your lip, when you add filler, sometimes you can correct it and sometimes you can accentuate it. And, you know, I think this shows that really nicely. Much more volumized, but still has the same contour as before.
Yeah, sometimes it's just difficult, and everybody's asymmetric. So you want to make sure, you know, here there's no upper lip, and even now, you know, this was more nasolabial folds, a little bit in the chin, to help fill those lines, and on the side. This is immediately after, so that you can see the poke marks. And then here, definitely hollowed. And even though there were 4 syringes of filler that were injected, laser is still needed because these up and down lines, the filler can only do so much, and there's still those etched in lines.
Yeah, absolutely. I think Bellatero is a nice filler to come in and chase some of these etched in lines for patients that don't want laser. Like I have some patients say, my friends had the laser, I don't want the laser, I don't want to look red. I show them pictures and they're like, that's not for me. And then you can come at this with a series of syringes, just doing serial puncture technique to kind of help fill each one of those. And sometimes people get really great results with that.
Now, which is Bellatero?
Bellatero is a really fine superficial filler. It's one that I like in tear troughs.
Hyaluronic?
It's HA.
Yeah.
Because it doesn't cause a Tyndall effect, so you can place it more superficially than other fillers.
That's MERS? Mm-hmm. All right, this is our youngest fan.
Oh, this is so cute.
Yeah. Let's see if he's, oops.
Is he going to play?
Is he going to play? He may not play.
Oh, no.
I thought he was ready to play. Hang on.
He looks like he's ready to play with that
he's ready
Derm
to
Bros
play.
headband on.
Oh, that's really too bad. Well, it was a cute kid. He's going to be on our Instagram and TikTok and all that.
Great.
Yeah, it was a shark. Fashionable scars. So the scar here, any traumatic scar that is indented most of the time, not always, can be injected with filler. Laser over that, probably pulse dye, then do CO2.
This is just filler?
Yeah, it's just
It's a nice result.
Yeah, so she was pleased with that. And here, these are the Instalift threads, and they do a good job. People need to have realistic expectations when it comes to these threads. So I'm going to just show a short video of me and Dr. Michael Gold, who's a dermatologist in Nashville, who came in when we had meetings in person. We were at the Bellagio, and this is me injecting a staff member.
He turns, and then he just tunnels down, and he's moving. Here's about the needle, here's the needle, here's the needle. I'm showing you where the needle is. Okay, and he's going to go right to the end here. He's going to take his needle cap. Before you do that, let me see the cap at the end. Okay, no, on the patient.
It's a great beard.
Yeah, that beard, that was my witness protection program beard.
And you go right into the needle. Right into the cap. Now, before you do it yet, so then he moves the needle holder, the needle cap, and the needle's out. Okay, you're not going to stick yourself. All right, you don't want to stick yourself with this procedure. So here he comes, and he's going to now put a little tension.
So with this needle, there was a series of pokes here just to numb, and then the thread comes out, and these threads have cones on them, and the cones sort of lift up off the skin, and then they secure in place when you put some back tension on them. And that's what you're seeing me pull these through. This is where we cannulated the area and then used a smaller
Yeah, that's a great procedure. I mean, each thread takes basically 3 holes in the skin, all under local anesthesia. Drop them down in the mid-face and thread them through, and people walk out with an instant lift that continues to improve over 2 years.
Yeah,
it
builds
really
collagen.
Great.
It's a nice procedure. Let me we'll finish out the video so that
Secure to that suture on the top. And they go 1, 2, 3, 4, boom, 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 boom. And all 4 of those sutures, all 4 of those cones are here. Okay? Here's the other bi-directional, so these are going up this way.
So the standard recommendation is to do 3 threads on each side of the face, but I found in practice that people really do a lot better if you can do 5 threads.
Sure.
And so threading the 3 just like this, which is how the procedures was initially designed to be done, is outstanding, but then coming back and chasing 2 from the jowl up towards the top of the ear gives people a really nice lift and helps redefine the jawline. So I actually am almost standardly recommending doing 5 threads on each side, because if you're going to spend the money to do 3, you might as well go all in and be really happy with the result.
yeah, it just takes a while to get, to do this procedure. It takes about 30-40 minutes.
Yeah, every thread takes time. The more threads you do, the longer it takes.
And because of those long needles, it's a little nerve-wracking as the physician, doing that procedure.
Yeah, I've switched to catching it with a comedone extractor. It's been a nice little...
Oh, that's clever.
Yeah, it's good.
I like that. So here's the, let's see here. Yeah, before and then after.
Yeah, I mean, this is an instant lift. I mean, it goes to show you why the name is the name.
Here's another one of mine that I did, and this is before, this is immediately after, and there's 2 weeks after. So you can see it's just sort of lifted the face up.
It's nice. Great result.
Mm-hmm. This is Kybella, and these are stock photos from Allergan of patients who've been injected under the neck, and Dr. Cotter did my under neck Kybella injections. I think I had it twice, maybe.
I think I only treated you once.
Yeah.
Maybe we did a second one. I can't remember.
Yeah.
Kybella's a favorite in the office.
Everybody
we like
likes that. It's an area that no matter how much you work out or what you do, you're not going to be able to get rid of this under neck fat. And it's not that you're out of shape, and it's not that you are unhealthy. That's just where you store your fat.
Yeah, and so Kybella is FDA approved for reduction of unwanted submental fullness, which is this fat pad that's right here. And it does a pretty good job. From a cost standpoint, it probably is more effective to have neck liposuction, and I tell most of my patients that. But for people that don't want lipo, want to stick to less invasive, Kybella is a great option, and it can be used off-label too. So I think I probably dumped about 30 cc's of Kybella into my love handles in the past.
I didn't know that.
Oh yeah. I mean, I figured why not give it a shot. I've put it in other places too, like kind of the jelly roll underneath the bottom, the top of the thigh, for the thigh gap. So those are all, to be clear, off-label. And there's been some bad outcomes for people that have had it placed too superficially. You can get skin breakdown. But in the right hands, you can do these off-label treatments and get some people some nice results.
So these are just some, injections. There's a grid, a centimeter apart, do the injections, and you can swell afterward, and you can see this massive amount of swelling. And so this is me when Dr. Cotter did my Kybella, and where I'm just sort of swollen under the chin. And then you can see how that went, a little bit tighter, and here I am now.
Looks good.
Yeah, I'm happy with it.
You swelled a lot.
Yeah, I did. Thanks for noticing. One of our estheticians got some Kybella, and then you can see how much tighter the neck is.
It's so funny. When I met her, she asked me, do you think I need more Kybella? And I was like, more Kybella? What are you talking about? You don't need any Kybella. Because I met her at this stage. And she says, no, Dr. Greenberg had injected me in the past. And I think it's a great example of how, you know, if you don't know what was done before, you would never know anything was done here. She got a great result.
Yeah. And, you know, here just injecting. And you can see right after, it just really swells 3 days post-op. And then the swelling goes down, and then the neck just tightens up. And it just takes a series of treatments. There's no one and done with it. So you have to be patient. This is just a little comic relief. I had a patient come in with a Crown Royal mask. I don't know if it's approved, but and then we got some pink scrubs for the office because everybody wanted something a little lighter and a little happier. It's been good. And the quote says, "I'm afraid the tests indicate that what happened in Vegas didn't stay in Vegas."
Ooh.
Pretty bad. And so this is part of the talk that I've given this talk before at different conferences, not necessarily because I'm the one with the complications, but we end up seeing patients who've gone other places and had complications, and then they'll come in and we get the opportunity to treat that.
Yeah.
So just know what the training is of the person who does the procedure, because you should be seeing somebody who's able to take care of any possible negative outcome.
Yeah, I think one way to think about it is, I mean, it's not hard to inject a substance into someone's face. The hard part is knowing if it's the right thing to inject, the right place to inject, and then if something goes wrong, how do you fix that? It's kind of like if you're going to take a taxi, sure, anybody can drive, but if you hit black ice and start spitting out, who's going to roll the car and who's going to keep you alive? And I've had patients that have had abscesses from filler, people that have had massive facial swelling. I've seen patients with skin breakdown because it's injected into an artery. So it's kind of anything can happen. And it's just important to know that even in the best hands that can happen, but the benefit of having the best hands is you have someone who can manage the complication.
Yeah, and we have a quote in our kitchen now. It says, "You don't judge a captain by how they handle a calm sea, you judge them by how they handle the storm." And when things get tough, you know, that's when it really matters who's treating you. And we clean up a lot of people's messes here. Good news is with Botox, very few complications. A lot of them you can correct quite easily, whether it's with iopathy and eye drops for a little droop, or just tincture of time can take care of it.
Yeah, so I always tell my new Botox patients when they say, well, what's the worst thing that can happen? Well, I tell them, well, the good news is that if something bad happens, it only lasts 3 months. But the bad news is if you love your Botox, it only lasts 3 months. So
yeah, that could be a problem. So here's just ptosis, where you can drop a brow, and you need to be careful where you're injecting.
Absolutely.
And some people have extra hooding of their eyelids, so they may not be the best candidates for Botox, and they may need blepharoplasty to cut off that extra skin, or the CO2 laser before. And here's just someone who has an asymmetric brow beforehand, and you can inject here just to make it.
Oh yeah, I think that's a great treatment.
And then these are the ones that end up. These make me the most nervous. Is the complications from filler. They're treatable, and hyaluronic acids, and we'll show some other things that can help. But this next patient came to me from Saudi, and I reached out to her today to see if I could show her photos. One of the nicest people I'd ever met in my life, and we don't know what injected over there, came to our clinic.
Wow.
And she said, "I think I have an infection." I said, "I don't think you're infected." She says, "No, I think I have an infection." And as it turns out, my God, she did have an infection. We ended up draining a lot of pus out of her lip. I don't know what substance was injected into them. And that was a really bad thing that happened to her. But these are her lips today. I asked her today, she sent me a photo. She was with her fiance, and said it was okay that I tell her story.
It looks great.
Share her
Wow.
pictures. So hopefully someday I can go out to Saudi and be there when we get to travel. I've always wanted to go.
Yeah. Good job, Doc.
Thank you. But she was happy, and she was on antibiotics for this, and we cultured it. And, I think it was a staph infection.
Wow.
Ecchymoses and swelling. So this is before, this is long, this is after. But this is the misery that was gone through with the injection, in that there was some bruising. Bruising we can handle. We have lasers that can help with bruising. But sometimes the bruising can be quite extensive when you bleed into the skin. And a laser works the best, pulse dye laser, to get rid of this.
Yeah, and I always offer to any of my patients, if there is a bruise, even if it's a tiny little pinpoint bruise from where the Botox went in, come on in and we'll laser it for free 24 to 48 hours after the procedure, just as a courtesy. It's one thing that is nice we can offer as a full suite medical and cosmetic practice.
Yeah, that laser is probably my favorite, the pulse dye laser, because you can see results instantly. And so here's her lips before, there's her lips after. This is what she went through to get there. I always warn people, if they're going to come in, like if they're going to a wedding or they're going to an event, don't do it right away, because you could swell for up to 2 weeks.
Yeah.
And you could bruise, and you could have bleeding, and there could be complications. And this is sort of cheating. This is a venous lake, but it's the same idea, where the pulse dye laser targets the blood vessel and destroys it. And this is me getting light stim after Dr. Cotter did his injections. And here are just some nodules. So you can inject and you can do everything right, and you can still get nodules. Where there's just pooling. Maybe it was injected too superficially. Maybe the body's rejecting whatever was injected. So I like to show the nodules. Are there any questions about complications? Okay.
No.
I wanted to end on a positive note, because these are really fun treatments, and I love to do them. I know that you love to see them, and patients who have realistic expectations. This woman was going to her high school reunion, and she just wanted to look better and more refreshed for that trip. And so I lined her lips, I bulked her lips, I put filler in the nasolabial folds and the marionette lines, and we did Botox that you can't see. You can also Botox around the mouth. That's another sphincter, the orbicular, it's another sphincter.
What about sphincter stock?
And you can soften the muscles there. It makes it difficult to play a wind instrument or whistle, but depending. Anyhow, she was really happy that she had these done.
She looks great.
And with that, I think we finished our round 8.
Derm Bros.
Derm Bros. Well, cheers to that. It's been a great run. I appreciate everybody sticking around, watching the video, learning a little bit about some of the cosmetic treatments that we do in the clinic. The fillers, the Kybella.
The neurotoxin, the Instalift.
Yeah, these are great treatments. So we're happy to answer any questions if there are any.
Cherie Roman says thank you.
Oh, thanks, Cherie. Thanks for lunch the other day.
Yeah.
Great. Well,
Hello from Luz Pinon on Instagram.
Hello. Well, with that, Derm Bros signing off.
Yeah, Derm Bros out. We'll see you next time. Stay safe out there.